So what Paul, my teacher I talked about in the introduction, what he always talked about were the practices that we do that allow us to cultivate stillness or mindfulness. He did have some Buddhist leanings. So to cultivate practices of stillness or mindfulness give us a little bit of a gap, like I was talking about, between the action and the reflex. If we can begin to grow that gap, we can start to see our habits. So what this means is that life is cultivated and maintained. We don't start tomorrow, or when I'm going to start my IVF cycle, then I'm going to really stop coffee and, start taking fish oil and all the stuff. Life is maintained and cultivated in every moment. And so, and every thought, every negative thought becomes you. So what are we creating in every moment? From this moment, be aware, and that means us. From this moment, be aware of ways of thinking, ways of saying. What are you saying to each other, to our children? What are the thoughts that go? What are our habitual thoughts? Ways of doing, my standing, or my whatever it is. Or being addicted to adrenaline. That's a good one. That's a hard one for modern people. We just like to be doing a lot of things at once and push through and all of that. That's a large demographic of our patients too, especially this group of patients with high FSH. Many of them are pretty addicted to an adrenaline rush, A-type personality kind of thing. And they're exactly the ones who don't want to hear things like, and Karen and I had a discussion about this yesterday, about, oh, just let go, or relax, or, these sorts of things. I mean, that's very difficult to begin at that place. And this sort of loops back to the introduction about what else was happening in the treatment room. So something else happens between the practitioner and the patient that allows a real authentic, true connectivity, that the truth can be spoken and heard. And it's usually not this point or this herb. So the goal of Yangsheng techniques is the migration from unconscious lifestyle to one of healing, health, happiness, and ease. So a question that seems to really come up so often in my practice is, how does it say? Is there a part of the patient that has lost her center or lost its connection to life itself? So this kind of reflexive person who, this is a common way it goes, at least in my practice. So if this is balance, then the patient, then she, it goes through school and probably goes through graduate school and maybe even more school after that, really doing a lot of it. And then from there, she wants to make a lot of money and household just right so that she can afford to have a child. And then to really kind of get through the day, because she's busy multitasking, she eats fast food and drinks a lot of coffee to kind of pump her up.